Hi, okay, I wanted to show you guys the critiquing form, the radiograph technique evaluation form that you're going to be using when you critique all your films. You'll use this all this semester. You'll use it all the rest of the next three. Well, more than that, you'll use it the whole 2 years that you are with us. This form gets used a lot. Anytime you take films, you critique them using this form in radiology. So I wanted to explain it and then talk about the retake criteria. So this is hanging up in the radiology in every operatory, this form. This shows the teeth that ideally, like if in an ideal situation, these are the teeth that should be on the film. So this is your molar film, this is your premolar film, this is the canine shot, bite wing molar, bite wing premolar, mandibular molar, mandibular premolar, canine shot, and central. And I'm not sure why the maxillary central incisor, but it's the same thing as this, just the maxillary teeth. So a few things to note here. Root apices, so the apices of all the roots should have 2 millimeters beyond the tooth in question must be visible. So that means that you have to have you want to have at least this much of the bone showing, 2 millimeters above the apices of every tooth in every picture, except for bite wings, obviously. And then a contact of tooth in question must be open, and an open contact is the ability to see the DEJ. So you can't see it in here. Let me pull out my FMX to see if I can show you a clear. These are very grainy because this is just a photocopy, but I can outline the enamel here, and so I've outlined the DEJ here. This is the DEJ. So this is the enamel, this is the dentin, and the DEJ is the dentin enamel junction. And so you want to be able to see that. So if there's an overlap, like let's see a little bit of an overlap, like here's a tiny bit of an overlap here, and there's this FMX has very few overlaps, really. It's very good. And there's a little bit of an overlap up here, but it's hard to see that. But anyways, if the crossing, you can kind of see there's that overlap, but that's kind of a wonky picture. But if the overlap is not so, that it doesn't cross into the DEJ, typically we don't retake it, although the criteria is that it doesn't overlap more than a third into the enamel. But very often in an FMX, you can see that space somewhere else. So we would only retake it if there was no way to see that interproximal space in any other film. So, okay, so going back here, study this film, this sheet, and get you have to start getting these memorized. So on all molar films, you always want the second molar to be centered on the sensor. So you can see that pretty close, the second molar is centered on the sensor. Now, sometimes when you do that, when you put it that far back so that the second molar is centered, sometimes you won't get all this anterior, but it's okay because you'll get it in your premolar shot. So you might cut off the mesial of the first molar in all of these pictures. You may or may not. It depends on the patient's size of their teeth, but you will see them in the premolar shot, so it's okay. So just think about that criteria for your molars, the distal of the canine for your premolar shot. That's one of the big criteria there. Centered canine. And this contact should be open here because very often it's closed in the canine shot because you're taking your picture on a curve. So very often this contact is closed here. So you want it to be open here. And this is just going to take you guys spending time studying these images and understanding what you're seeing. So read these important notes. When evaluating for a retake, you must consider the patient's risk for disease and the ability to obtain the visual requirements. Although a retake may not be required, students should recognize all technical errors, discuss modification necessary to correct the error on all radiographs. So you may not retake it, but you need to identify the errors. All teeth must have the contacts open at least one time in one film. So if you closed this contact, but it was wide open up here, that'd be okay. You wouldn't have to retake it because you closed it. You'd mark the error, but you wouldn't have to retake it. Open contact is the ability to see the DEJ. If the overlap is just in the enamel layer, it's not a retake. The alveolar crest bone must be visible for all teeth in at least one film, and the root, apices, and 2 millimeters beyond must be visible in at least one film. Incisal edges should be visible, however, only retake the film if more than half the crown is missing. So if it's just the tips, the cusps, that's okay. If it's into half the crown, you retake it. Extreme cone cuts on any film may warrant a retake up to the discretion of the faculty. So if you've cone cutted half the film and you can't see something anywhere else, we would retake it. But if it's just a small one that nicks off this, a little bit, you don't have to retake it. If it's seen somewhere else, then it's okay. All right, so I want you to be familiar with that, and then radiographic technique evaluation. So let's just do a couple of these together. The way this form works is this is like a mount. This is like a full mouth series mount. Every box corresponds to a film. So you can see that this setup is the same as this setup. We have the molars, the premolars, the 3 anterior, the 3 anterior, oops, I'm off the screen. The 3 anterior here, the 3 anterior here, mandibular, and then this side over here. So it's a perfect match. So you just go to your upper right side. I'm looking at it as my left, but it's really my patient's upper right. And then you just critique it. So we look at this film, and I can see that there's a little overlap here. So I'm going to mark horizontal angulation. And then my second molar is way toward the back. My second molar is not centered. So I'm going to put a placement error. And then what you do, so you mark an X, and then if you have to move your film, you want to shade the part of the X where you would move your sensor to correct the problem. So we need to move it more posterior. So I'm gonna highlight the back part because we would need to move this film more posterior to center the film, the second molar. And then on this film down here, there's a tiny little bit of overlap again between 2 and 3. So we'll put horizontal angulation there. Our second molar is right in the center, so that's great, but we can't see the alveolar crest here. So that's a positioning error. And the patient isn't biting down all the way, so if they had bit down, we probably could see up there a little bit better. And we want to move it up a little bit. The patient has to bite a little bit better, and we need to move it up a little bit so that we can see that alveolar crest. And that's how you critique it. So if you look over here at the technical errors, you have placement. That's if you can't see the apex, you can't see the crown, you can't see the teeth that are supposed to be in the image. You have horizontal angulation, that's closed contacts. Vertical angulation is elongation or foreshortening. Beam centering is if there's a cone cut. Other could be like if you had the sensor turned around backwards and it didn't expose it, or say you had the XEP set up wrong and it didn't end up taking a picture, or something like that. And then if you do need to take a retake, you'll put an R in the box. So if you had a bunch of errors and then you didn't get what you needed to see anywhere else, then you'd put an R there. And so you critique every single film just like that, and then you have your instructor come over and see if and correct it and see if you've done it right. and they'll circle what they agree with. So if they agree, yep, that you did good there, you did good here, you did good there, but you don't need to retake because you actually have it here, or whatever it ends up being, the instructor will go over that with you. So I hope that that gives you at least a good starting point, and we'll talk about it more in lab, of course, and you can always ask me questions too.